KRASG12C mutations are common in non-small cell lung cancer, probably occurring in about 13 to 14%, and this has been an undruggable target for many years. Recently, about a year ago now, we saw the FDA approval of Adagrasib, which is a KRASG12C inhibitor, previously known as AMG 510. Objective response rate 37.1%, median progression-free survival 6.8 months, and median overall survival of 12.5 months. So really proof of concept that we're able to target KRASG12C. So today we saw the presentation by Dr. Alex Spira of the KRYSTAL-1. So this is the drug Adagrasib, which is a novel KRASG12C inhibitor. It specifically has characteristics of improvement in the half-life, about 24 hours, dose-dependent PK, and I think what's really exciting and interesting here is that it has CNS activity, both preclinically as well as clinically shown in the presentation today. So we saw data from the phase 2 dose expansion of Adagrasib at 600 milligrams BID. The response rate was 43%, which was quite impressive. The median progression-free survival here, 6.5 months, and a median overall survival of 12.6 months. The toxicity profile was slightly more than what we saw with Adagrasib, so slightly increased GI toxicity, mostly probably due to the capsule formulation, and we are now looking at the tablet formulation. But interesting, when you look at dose discontinuation rate, it was pretty equal in both studies, so 7%. So this is a major move forward for our patients with KRASG12C mutations. We now need to look at resistance mutations. We need to look at combinations more in depth, as well as how do we move this agent to the frontline setting to benefit our patients in the frontline. The CNS activity is really an interesting question. So we know that brain metastases are common in patients with KRASG12C mutant non-small cell lung cancer, probably in the 27 to 42% range from published data. And what's important to note about this patient population is that the prognosis is quite poor. So median overall survival is only about 5 months. And we know preclinically that this drug has very good CNS activity. We published data in Clinical Cancer Research recently looking at 2 patients that will be presented, looking at the CSF concentration of the drug by measuring the KPUU. So it's a lumbar puncture where you measure the drug concentration, and the KPUU of these agents in median was 0.47. When you compare that to osimertinib, an EGFR TKI, this has far better intracranial penetration and what we've seen clinically a response as well. In the data presented by Dr. Spira, we saw an objective response rate in patients with treated brain metastasis of 33%. So that's quite impressive. These are patients who've had some form of radiation. When you compare that to Adagrasib, that's in the 13% range. What we'll be presenting is a separate study, the phase 1B cohort of patients with untreated active brain metastasis, and the response rate there is 32%, and we did not yet reach median overall survival. And that's quite impressive and important because, again, the prognosis for this patient population is quite poor. So this may be a differentiator moving forward for this agent in patients with known active brain metastases. So I think we need to better understand the resistance mutation profile. There are on-target RAS mutations that may be targetable, and then there are other bypass track alterations. So combination strategies here will be critical, potentially inhibiting upstream with a SOS1 inhibitor in combination with G12C inhibitor, or a SHP2 inhibitor in combination with a G12C inhibitor. And I think that's going to be an important strategy. Another important strategy potentially to move the drug forward is combination with a PD-1 inhibitor. KRYSTAL-7 is currently ongoing, looking at that patient population. So it'll be exciting to see the data. The drug from Amgen, the AMG 510, now known as Adagrasib, is also being looked at in combination with PD-1 inhibitor, pembrolizumab in the front line. So there's a lot of data that needs to be shown and seen before we understand which one of these drugs will move forward in the frontline setting. But definitely an exciting time for our patients with KRASG12C mutant non-small cell lung cancer. This has been a target that has been undruggable for the past 30 years.